Today I want to talk to you about acid-base balance, particularly metabolic alkalosis. The main components in the acid-base balance are pH, PCO2, PO2, and the bicarb, which is HCO3. The pH. It defines the acidity or alkalinity of the blood. The normal range is 7.35 to 7.45. If the pH is below 7.35, the patient has acidemia and hydrogen ion level is increased in the blood. On the other hand, if the pH is above 7.45, the patient has alkalemia and the hydrogen ion level is decreased in the blood. PCO2. This is the partial pressure of carbon dioxide dissolved in plasma. The normal range is 34 to 45 millimeters of mercury. The PO2. This is the partial pressure of oxygen dissolved in plasma. The normal range is 80 to 100 millimeters of mercury, and the bicarb is HCO3. The normal range is 22 to 26 milliequivalent per liter. Let me start with uncompensated metabolic alkalosis. Metabolic alkalosis occurs when there is a decrease in hydrogen ions in plasma and therefore a high pH, making the blood alkalemic. In addition, bicarbonate is high and CO2 is within the normal range. In analyzing the blood gas, first look at the pH. Next, look at the CO2, and finally, look at the bicarb. In primary metabolic alkalosis, the pH is higher than 7.45. The CO2 is within the normal range, and the bicarb is high, more than 26 milliequivalent per liter. Here is something to remember. Chloride and bicarbonate are the only anions present in any significant quantity in the extracellular fluid. Decrease in one leads to an increase in the other. In uncompensated metabolic alkalosis, the pH is elevated, normally above 7.45. The bicarb is also elevated, and the CO2 is normal. In compensated metabolic alkalosis, the pH is elevated, the CO2 is elevated, and the bicarb is elevated. What are the signs and symptoms of metabolic alkalosis? This might include restlessness and lethargy, tachycardia, confusion, dizziness, and irritability, nausea, vomiting, and diarrhea, tremors, muscle cramps, and tingling of toes and fingers, and hypokalemia. What are the causes of metabolic alkalosis? This might be a result of severe vomiting, excessive GI suctioning, diuretics, and excess sodium bicarbonate. Well, thanks for watching. I do hope that you will like, share, and subscribe. I wish you well. Good night.